Hi, it's Dr. Trindade with another tip on how to prevent the COVID-19 disease in this day and age. Today, I really want to focus on movement. So exactly what do I mean by movement? I mean moving your body. To me, exercise can be a bit of a dirty word, so I much prefer to use the word movement and to just move my body. I'm not the type of person that likes to go to a gym or work out even on machines. I mean, I can do it on occasion, but that just isn't me or my personality. But I love to move. I love to be able to move my body. I love to dance. I love to do stand-up paddleboarding. I love to go on a walk or hike. I love to swim. I love doing housework, believe it or not, because that is one way that you can move your body, get your lymphatic system draining and working properly. So I want you to think about what exactly do you like to do that moves your body, that involves movement. And then I'm going to give you a few tips that you can incorporate, because I think we often forget that we really have sort of 3 circulations in our body. Really 2, but when we think about circulation, we know about the arteries, right, which carry blood from the heart out to the periphery. And we think about the veins, which carry blood from the periphery into the central part of our heart, or I should say a central part of our body, predominantly our heart. And I'm simplifying this because I'm a simple person and I like keeping things simple. But we often forget that we have a 3rd way of moving fluid around our body, and that is the lymphatic system. Now, let's back up just a minute. When we think about the arteries, what are they known for? They're very muscular, and they have to be in order to be able to carry the blood out to the periphery, right? So it gets into our tissues and our organs. And what about the blood getting from the periphery back into the heart? How does that happen? Do you ever think about that? Because it's going against gravity. Well, it's because veins are equipped with valves. And these valves can open and close, and so it allows the blood to come back to the heart. They also have some muscle, but very little. On the other hand, the lymphatic system doesn't have muscle predominantly and doesn't have valves. It requires muscle movement in order to move the fluid around, right? And this is very important because the lymphatic system is involved in protecting us from disease, right? It's part of our immune system, if you will. So we need to be doing varied and some pretty strong movements in order to try and get the lymph to circulate. So this is why I feel that movement is a much better word than exercise. Also because I don't like the word exercise. But I end up exercising a lot. It's just a matter of terms. We often also think, and I find this particularly when I talk to my patients, that to exercise, quote unquote, you need to do a strict routine, right? We have studies showing that for the cardiovascular system and prevent heart disease, you need to do 30 minutes continuous where you get your heart rate up. And there's formulas based on your age, exactly how much to increase your heart rate. But I want to be simple. I want to focus on what do the studies really say, especially about people who may be confined to a wheelchair or are at home right now in the times of COVID-19 and may not be able to go out and walk or take a hike or even go to a gym, if that's what you prefer. So let's consider, for example, the diabetes prevention trial. Very large trial that was stopped early. And what did they do for one of the groups, which was the lifestyle intervention? They included 150 minutes of brisk walking per week. And we know that the lifestyle group, in terms of preventing diabetes, far and beyond outweighed the drug treatment group. We also have studies that even just contracting your muscles, or even just small amounts of movement, is beneficial, both for heart disease prevention and also for obesity, as well as for diabetes. So we need to tailor it to your needs and what is best for you. I'm going to show you a series of exercises that you can do while you're at home that include movement. But I'm going to start first with the most simple thing, which we all have to do. Stretch, right? We need to get up in the morning and just really stretch. And I like doing a movement that really helps the lymphatic system. And that is to just move up and down. My feet are not moving from the ground. In other words, my feet are in the ground, but I'm shaking. In a sense, I'm bouncing. And if you have a rebounder, you can do this. And you're going to also do it with your arms. And you just shake it all the way down. It's important to do this in the morning when you first get up and when you go to bed. And I also like including a little brisk massage of the axilla, because that's an area where the lymphatics usually tends to get a little bit stagnant. Okay, so you do this first thing in the morning before you go to bed. You can do it for a minute and a half, longer if you like. The other thing is housework. We all have to do it. Vacuuming, for example, that can get your heart rate up. And you want to sustain it, but we also know that intermittent, so high intensity interval training, for example, can be very protective. And we know that even just 7 minutes of high intensity interval training is sufficient to prevent disease. I'm going to show you an article that appeared in the New York Times that talks just about that. So this is a 7-minute scientific workout that I was talking about. And you can start out by just doing, for example, the jumping jacks for 10 seconds and then resting for 5, sitting at the wall for the same amount of time. Same thing with the push-ups, the abdominal crunches. All of these you can start 10, 15 seconds with a 5-second interval and then work on up to 35, 45 seconds within a 15-second interval. So you have the 7-minute scientific miracle workout. You can do your housework, remember that counts. Don't forget to do your lymph drainage that I talked about before you go to bed and first thing when you get up in the morning. And also think about your chores. Yesterday I washed my entire patio. It took me 5 hours. During the whole time my heart rate was up, and that was a great workout. Even though I was doing something that I like because I really wanted to get it done. It's been raining quite a bit here, and so there was a lot of green, sort of slimy areas that of course are very dangerous to walk on, and that was a great exercise. You can also do a walk, for example. Today's raining, so I didn't take you on my usual walk, but I have a walk that I do. It's about a 30-minute. It is going downhill and uphill, but you can also do a flat walk. Remember, any movement, even just contracting your muscles, that helps, because in moving, remember, we are increasing our lymphatic flow. We're also, of course, increasing our heart rate. We're helping the blood flow, whether it's through the veins or through the arteries. Movement, movement, movement. Any movement is good for you. My best to you. Make it a great day.